Warm welcome, everyone. My name is Lisa Witter, and I'm the co-founder of Apolitical. Welcome to Government Aftershock. And I just want to say at the top, thank you, all of us, for joining. This is a time, an unprecedented time for many of us. So much learning and so much reflection, and kudos to all of you for taking the opportunity to sit back and learn and engage in this great initiative by OECD. Yesterday, there were over 60 events that took place around the world tackling different issues, but all focused on what do we need to leave behind from this shock to our system? What do we want to keep and what do we want to do differently? Yesterday, there were more than 4,500 people participating in things from governance to participatory futures, climate, smart cities. And lots of words and themes came up around modernization, new reality, gratitude, leadership, ways of working. So we're going to explore that here with 4 countries' perspectives on sense making, making sense of what happened to COVID-19. And basically in 3 blocks, how did we early respond? What did we learn? And what do we want to take forward? I'm really excited to say that this session today is organized by the UAE government and Demos Helsinki. Apolitical is really proud to be part of that. And we have 4 speakers. So as I announced, if you could just wave at everyone to try to make it a bit human. Her Excellency Huda Al Hashimi. She's in the government of the UAE, Chief of Strategy and Government Innovation. I've had the pleasure of knowing Huda for a while, one of the greatest, most dedicated minds of government around the world. Admir Šahmanović, how did I do, Admir? Director General of the Ministry of Public Administration of beautiful, sunny Montenegro. We're going to hear more about weather and how that impacts COVID coming up. Siim Sikkut. He's the Chief Information Officer of the government of Estonia. Many of us learn from and look to Estonia quite often. And we have Wiku. Nice to see you, Wiku, wearing a mask, reminding us all of this time. Adisasmito, who's on the National COVID Task Force and is out of the University of Indonesia. So what I want to do at the very top here is I want to get some polling questions ready. So these 2 polls are going to come up on the screen. And as you are responding to those polls, and we'll come back and look at the answers, I want to give you a quick overview of, we're talking about the UAE's experience, Montenegro, Estonia, and Indonesia. And I wanted to give a quick, what's going on in these countries when it comes to COVID. So I'm just going to share my screen. So, this is of November 12th. So in Estonia, we have, there was around 7,000 cases and 76 deaths. You can see as you look across, there's a spike going on there, as there are in many countries right now, going up in the 2nd or 3rd wave, depending on where you are at. It's quite low over the summer. The UAE, sort of up and down, up and down, up and down. 523 deaths. We're going to hear from Her Excellency how open or closed and things they've learned along the way around that testing, vaccination, where they're at in the process. Montenegro, you can see 364 deaths, dealing with a bit of a spike there at the end. Indonesia, 14,000 deaths, obviously very populated country. Spike and then back down. We'll learn about how these spikes happen and how they may have been controlled or not by weather, by things that governments have done, and masks. You can see sort of where we're at. This is from the WHO on positive rates over time, and where people are at, where people are flattening off, and where there's a bit of an uptake. And I think most importantly, you can see per capita what we have. So Montenegro has pretty high per capita, but we're going to hear from Admir what that actually means in his country. The UAE has low per capita, and Indonesia, while it has a lot of rates, it's low per capita. And I think, interestingly, many of us were worried what would happen in places like Africa. Would there be high spikes? And you can see sometimes the per capita has been quite low. So lots of really interesting things to understand about the virus, which we won't be getting into the science of the virus, but we will be getting into the response of how these governments did it. So how we're going to run it today is it's going to be a bit of a quick fire because there's 4 countries with lots of important questions, and I'll stop sharing my screen here with a bunch of questions. But let's first go to the polling responses to these first 2 polls we had. So the first poll we had was your government's response to COVID was better than expected, about what expected, or worse than expected. I'm seeing here if I can get the responses. It's kind of a tricky way to get them here. Let's see that we have them. We can come back to them if we don't quite yet. Then the second question is what I wished my government had done that it didn't to respond to COVID. So I asked better technology, faster decision-making, more flexible mindsets. Huda talks a lot about mindsets in her work. And more knowledge, better communication skills. Okay, so Jamie, thank you, Jamie, just sent the first results. So on, it's about 50-50, better than expected, about what expected. Nobody said worse than expected. I imagine we have a lot of government people here joining, so there might be a little of a bias, but let's just hold that there's not. And then what I wished my government had done that it didn't do or had, better technology was, well, number 1 was more knowledge, tied with better communication skills. I have to say at Apolitical, consistently, we hear that from governments wanting, and public servants wanting better communication skills, followed by better technology and faster decision-making ability, with 0 people saying more flexible mindset. So perhaps some of the agile training and thinking that's been happening in governments is taking hold. So great, thanks all of you for answering those questions. We'll have some more polls at the end. So here we go for our quick fire. Huda, I'm going to start with you. In a word, followed by a brief explanation, describe your government's COVID response strategy. Huda.
First of all, always a pleasure to be moderated by you, Lisa, and always a struggle to try to compress my thoughts in such a short period of time. But if I was to say our government's response to, like all governments around the world, was one is that we were taken by surprise, but our response was one of speed and agility. So I think those are the main things, and to prioritize. And if I can maybe elaborate a bit more, is that early on when it hit us, and I think it hit us early March when it really started to resonate, the first communication that came out from our leadership was that there's a red line, and the red line is health and food. So that's when we meant about prioritization. So all efforts went into planning for the worst and planning for the extreme in terms of rallying up our healthcare, being early adopters of testing, drive-through testing, massive amounts of testing just to understand and gain knowledge, heavy investments, and also in terms of gearing up our sterilization in areas in terms of what we don't know and what we don't understand, mainly because we were seeing what was happening in Italy and in Spain and of course in China. And the other key thing that we looked at, and we reaped the benefits of that, was in food. We're in a region where logistics in a lot of countries stopped shipping food, and we are an importer of commodities of food. So in 2017, we announced our Minister of Food Security, and we reaped the benefits of that, where we had a very strong storage capacity of our food, and we had a very strong area to not depend on importing of that. But because of that benefit that we reaped, we were able to also provide aid to our region and aid to the international. Almost 120 countries benefited from the food aid that we actually provided. So we weren't just looking at our country when it hit COVID, we were looking at how we can support other countries as well. And this is something that did not stop with COVID. Early intervention and investments in science and technology. We invested heavily in adopting the vaccinations and looking at research in stem cell research. We looked at areas in terms of telemedication. And I think one of the big things that we did is that continuity. The big message was that nothing stops. The economy, stimulus packages, I think that's common across all countries, that economy was critical in terms of how we can stimulate the economy, but equally in terms of continuity of business, access to services, access to education, we weren't impacted by that because we easily migrated. And maybe I can explain a bit more in the other questions as well.
So fascinating. So I know, Huda, in your work in the government, you've been doing a lot of work on getting that agile mindset and practicing moving quickly. So it seems like that benefited. And also your, food security wasn't something that I think all countries had to think about at the level that you did, but your country used that as an opportunity to support the region. I think you said 120 countries. So let's go back to that. Let's move from the UAE to Indonesia, an island. So I'm curious sort of what externalities you had to think of. Wiku, in a word, describe the government's response in Indonesia and describe it a little bit more in detail like Huda did. Welcome.
Okay, thank you, Lisa. Yes, Indonesia is a big country in Southeast Asia with 267 million population. It's in a great challenge with the COVID-19, of course. We started with the first case on the 2nd of March 2020. And up to now, we already have 474,455 cases positive. And if we rank across countries, 1 per 1 billion populations, we are ranked 130 over 219 countries in the world that is affected by the COVID-19. And the recovered rate so far reaching 84% at this moment after 8 months of controlling the disease. And at the beginning, what we are facing was how can we monitor the impact of this COVID-19 or the movement of this COVID-19 viruses when we don't have one single data system. So in the first month, we developed a platform. We call it Fighting Against COVID-19, which integrate all of the data across 514 districts and cities across Indonesia of 34 provinces. And we manage over about a month after that, we integrate all of the data, surveillance data, case data from the hospitals, and etc., and put things together. And then we make the map, and then we make the zonations based on the indicators that has been suggested by the WHO, so that that dashboard was going to be used by all of the leaders of the either governors, the mayors, and also district health or chairman. And then all of those leaders read that dashboard all together with also at the national level, so that we build the monitoring system, so that finally we can control the disease, because every week we update the situations across. And also as my positions as the leader of the expert team, and also the president asked me to be the spokesperson of the COVID-19, so that every week, twice a week, I have to announce to public the performance of how each areas in Indonesia control the disease based on the zonations that we monitor, because all of the deaths, all of the recovered, all of the positives are recorded daily, and make them interoperable. So that
Professor Wiku, maybe we can come back to some of your other responses, but I think what's really interesting about your intervention was it sounded like prior to COVID, there wasn't this data response system. And because of COVID, very quickly, something came up, and then you use that data to drive the communications with the public. So I want to come back, because you answered sort of what was a gap, the technology that other people responded in their poll, better technology was needed, and you created that. I guarantee if there wouldn't have been a crisis, it would take longer. I think we all know that crisis sort of moves people. Let's move to Estonia. Siim, you're the Chief Information Officer. Everybody has high expectations for Estonia and digital. So what was your response? Was it located around tech? And would love to hear how you all handled it.
He was definitely sort of, entrenched in tech, and by the way, hi as well, sorry. But I think if I had to say one word, I think speaking very largely, the word is responsive. So meaning in a sense that we really have been trying to tackle the situation iteratively to see sort of what works and what needs to be done, because there's so many unknowns, and the situation keeps changing all the time. So my point being that in a way, I think as a saying went, crossing the river by feeling the stones. I think that's been really our strategy, with digital or without.
So response, fantastic. Admir, how about you in Montenegro? How would you describe in a word your response, and what did you do?
Well, good morning, everyone. I'm very glad to be here today and to share the experience of Montenegrin government. I can say that today, when all governments are in the middle of pandemic crisis, Montenegro is also mobilizing all its policy departments, is facing the new reality. The government assures that every sector of administration and society takes ownership of and participates in the response to COVID-19 and in preventing cases through hand hygiene, use of masks, and individual level physical distancing. The focus was on preventing community transmission by rapidly finding and isolating all cases, providing them with appropriate care and quarantining, and supporting all contacts, of course. In addition, government is suppressing community transmission through control measures, population level, physical distancing measures, and appropriate restriction on domestic and international travel. The overall objective of our efforts was to reduce the pace of the COVID virus, to flatten the curve so that a large number of people do not become ill at the same time. And as a result of the virus spread, contacts were limited, and the work of the public administration had to be adjusted to the new non-physical contact measures. Public administration has been under increased pressure, and it was more than ever important to ensure continuity in providing services to citizens, resulting in a rethinking of working patterns, service provision, and communication methods with citizens and businesses. In order to better respond to the needs of the citizens, as other governments, I suppose, has started to provide all relevant information on national portals, mobile applications, and through social media platforms. Digitalization and provision of e-services has been in the focus both on the central and local level. And the government of Montenegro has made rapid adjustments, having in place internal ICT procedures and a relevant legal framework that allows the new working procedures. Software developers in public administration were mobilized and engaged in designing new apps and services to help in the fight against COVID. In particular, the Ministry of Public Administration, as a priority, provided secured communication channels to all public servants to work remotely, since teleworking was the only option for providing continuous communication with citizens and the economy sector. Official and secure email and developed and upgraded e-services as a channel for providing services were introduced. Therefore, citizens and business could, as before, proceed with accessing their rights and receive all necessary support from public institutions from their home. That was our first mission, and I think that we succeeded very well.
Thanks, Admir. So there's some similarities here. So Huda started off saying continuity, both signaling and actually having continuity. As we heard in Indonesia and also in Montenegro, creation of new things, sort of moving things very quickly that needed to be done in order to it. And without this pandemic, it wouldn't have happened. So you mobilized software developers and went to e-services. We saw that at Apolitical, sort of rapid digitization of services that wouldn't have happened before. I want to stop for just a second, though, and note the remote working of public employees, because that is not a small thing. We see around the country when we did polling along the way that public servants needed to, as they were serving citizens, they needed to be able to work remotely because they couldn't go into the office. And so I think this is going to be an interesting new normal. And then Siim, you talked about the responsiveness and the flexibility, which is definitely a hallmark we've seen of Estonia and using that sort of agile mindset. I want to ask each of you, not each of you, but whoever wants to answer this question. You talked about all the good things that happened. Is there anything that any of you want to say that you wish in hindsight would have done differently? We often learn from things that don't work. Anyone want to share what didn't work, or you would have done differently? No? Then let's, Siim,
I
yeah.
can chip in briefly, sorry. So despite what we learned, despite all the things we did digitally, our issue really was also data and situation overview quite a bit. Just because, again, with the, as I said before, so many moving parts. And I mean, for us, it was a very good sort of, indicator that, look, data maturity is something we need to be working on. In a sense, it's making sure that, if people start making decisions, do they ask, do we really have the data? So we needed to sort of basically switch a bit of gears and have a bit of crash course on that, get data flowing, get it published for public, basically making sure that, as decision makers, we're actually working from data all the way to political level. So, and I think that's a crash course was way overdue.
Wow. Okay. So actually, looking at the data integrity, like, is it the right data, and then how to interpret the data. We definitely see this at Apolitical, that people want those data literacy skills. Very, very important. I'd love to hear later how you did that. Don't you wish there was like a documentary that's being made about all these awesome public servants around the world adjusting and learning and working from home and doing this work? I find you all the superheroes, the unsung superheroes. I want to ask whoever wants to answer this question, what was the least obvious insight to come out? Like, did you all learn something that you thought, oh, I would never have thought that I would have learned this in the response to COVID? Huda, you're smiling. Was there a...
I'm smiling because I think it's a bit personal, and I think probably you can relate as well, Lisa. I mean, for me, the thing that surprised me the most was that the population that adapted the fastest to COVID were the children, the younger generation, and that was something that I didn't expect. I mean, from one day going into a classroom of 20 plus students and interacting to suddenly switching to remote schooling and adapting to it so seamlessly was the biggest surprise. I mean, I had 3 of my children studying from home and myself having to work from home, and how we sort of managed to do that in 4 months. For me, that was the biggest insight. If I was to reflect back and say, I just don't know how we did it, but we did it, and it was an eye-opener to understand that the youth, they're more resilient, they're more adaptive to change, and they're more adaptive to technology and embracing it faster. So for me, that was a big insight to say, what qualities do they have that we need to learn from, so that we can all be in a more susceptible for anything that comes our way.
I like it. How do we be more like kids? Admir, what did you learn that was, something you wouldn't have expected?
I think that we should use the experience of what happened during the pandemic to speed up its future again, than fighting similar situations affecting both social and economic life, as Huda said. I believe it's fair to say that there are things that we need to learn about how we handle the pandemic in the early stages. And I'm quite certain that there will be plenty of opportunities to learn the lessons of what happened. Surely there are things we could have done differently. And of course, there will be time to understand what exactly we could have done in this particular situation. Certainly, it's clear that we missed a strategy or a policy paper for same or similar situations with clearly defined measures and instructions. It would have helped if such a document was developed before or during the overall pandemic process, and this transition itself would be much easier. Also, timely introduction of relevant measures might have ensured better health protection. The government, although have proposed the relevant actions according to daily analysis of number of infected and number of deceased, all broken down by municipalities, but was clearly missing relevant social analysis and impact analysis on social life of both children and adults. Included quantitative forecasts such as the impact of restrictions on economy and financial stability of both businesses and overall impact on the budget stability of the country. All of this led to fragmented crisis response instead of bringing together coordinating bodies from different sectors working together on coherent response. But also, I could add that Montenegro public procurement process proved to be long and not adequate for fast response as it was needed in this situation. Therefore, e-procurement procedures must be introduced, and those especially for urgent situations such as pandemic, in order to provide adequate and rapid response, especially to the health sectors in this situation. Promoting the use of e-procurement tools and digital innovation to simplify, harmonize, and accelerate procurement practice is desperately needed.
Well, thank you for that, Admir. We definitely hear, even when there's not a crisis, a desire from public servants to work across boundaries more. to really have a more system holistic approach. And we have definitely been hearing for procurement reform, not only faster and better, but more transparent. So on both sides of it. So perhaps there will be a procurement revolution. Estonia, any surprising insights that you had that you wouldn't have expected?
I would say a bit differently. I mean, obviously, we had a lot of surprises on the actual sort of situation level. But I mean, what really sort of struck me was more a reminder than a new thing in a way. And I think in our sort of setup, we learned quite a few things in that, we otherwise might have keep forgetting. And so my word, let's say, what I'm focusing on is community involvement, or what we benefited a lot from and was surprised, we had to be reminded of this, is that, it's not just up to government. I mean, the whole community. I mean, if I speak from digital response, the tech community, the hackers, these guys want to be involved and help out, even for free. So we actually had more folks come to us as a government saying, look, can we help? As opposed to us sort of needing to reach out. And so the issue more was our readiness to have them work with us was a bottleneck, as opposed to, not having enough sort of resource from the field. So if you just give a few examples, we went to not like a full lockdown, but like a special condition, as I think it's called, with like restrictions. We went on a Thursday in March. On Friday, we started a weekend through hackathon initiated by the community, the tech community, to say, look, there's some quick fixes we need to build, digital fixes and otherwise. For example, how do we manage to stockpile of protective gear, whatever like that. So how do we have a public map about what's happening with coronavirus around the country? So quick fixes they built over the weekend, helping us out, and we took quite a few components and services from there into an actual stack of response mechanisms. And same thing later on. So if everybody has been building or applying corona tracing apps, for example, again, that in our case was built up with government collaboration, but still by private sector as pro bono, because they wanted to help out. So my point being, the sort of readiness for community to really come together and help out and work together. We've always had that in the beginning of digital government in Estonia, but it's good to see it still revives. And I think the learning point from us is that we better use and think of and manage this consciously, and make sure that we are ready to actually have them work with us, as opposed to just keeping them on the side idle.
Well, listen to all this legacy that's been created, right? There's new data systems in Indonesia. I'm sure there will be a new way to do procurement. There's a new way to think about how to engage with the private sector. In Indonesia, Professor Wiku, what was the big surprise or insights that you all saw?
Okay, thanks. At the beginning, in the first or second week of the pandemic in Indonesia, is that we had a shortage of the PPE, personal protective equipment, especially the coverall and gown. And we realized that Indonesia is the sixth country in the world that has the textile industry, the biggest, sixth. But we realized that all of the PPE that we had, it's basically that it's ordered by the other countries, South Korea, and then the raw materials are from South Korea and also China and Taiwan. And then they made the PPE in Indonesia. When we needed that PPE, we don't have enough. So that's why I managed to discuss with all of the industries, with the government officials, and then ask why we don't have the PPE. And then after 2 hours of discussions, including with the WHO representative in Indonesia, we finally found that we had the raw materials in Indonesia, which is polyester. And then I asked the industry to make that and to test that materials, and then we send it to the United States to get the ISO standard 16004 and 16003. I remember the number of the ISO. And then finally we passed that ISO with the highest level of protections. And then when I check how much we have in country for a month, if we have to deploy all of the resources, and they said, we have 17 million gowns. So I said, if we want to have the humanity actions in the world, we can share what we have the resources to all over the world, because scarcity of, this is very important to protect the healthcare workers. So that's that's one of the. I was surprised that because of this, COVID-19 disruptions, then we found that we can develop by our own to have the personal protective equipment.
Thank you very much. OECD bringing us together is about learning from each other, and so we're hopefully throughout the pandemic we were learning from each other, and hopefully we're learning now, but also just how interconnected the world is. Huda, food storage capability and getting food back out, that the ISO, whatever the number was, Professor Wiku, you remember, had to go to the United States, and there was raw material from South Korea. This interdependency requires global sharing and global cooperation, and that's exactly what OPSI is trying to do with this aftershock. So now I want to move in. We talked about sort of what happened, what was surprising, what would you wish you've done different, a little bit about the legacies, about what's going to stick. I'd love to hear a little bit more about what do you think is going to stick, and how new ways of working, new institutions, new trust built or not with the public, new procedures, how that might help us tackle other problems that we have coming down our way, such as climate change, and what really needs to happen to institutionalize these new ways of working. Like, are we really hopeful that something new is going to come out of it, or are we going to slip back? So Huda, I'll start with you. Like, how do we make this the new normal? What is that going to take? And do you have other insights on what the new normal might be?
So I think maybe if I can start by thinking, I mean, we've heard this word a lot with new normal, along with unmute. I think that's been the trending word across these months. But I think for me, if I was to say there's something that's the obvious, and the obvious is the remote work. But the question is, to make it a new normal, we have to really look at it in the sense that how can we find ways to measure productivity of staff when they do opt to work from home? And I think so far we haven't been able to crack that. And I think that's something that, if we want to shift and to make it something that, I mean, with private sector, there are a lot of private sector have already moved on to this and have legislated that. But with government, probably with the vast number of people and of staff that there, I think it would be interesting to know if somebody could crack, how can we measure productivity with remote working? I think that technology is there, but it's a matter of ensuring that the staff is actually producing, and how do we measure that? I think the other thing that is coming out pretty strong is the importance of anticipating, the importance of proactiveness. I think one of the things that we reap the benefits on early on is the fact that we preempted key things and we invested in it today rather than later. And some examples were our heavy investment in digital services almost decades ago, and we reaped the benefits of it because when we migrated to online, it wasn't something that was difficult to do. We were able to provide services to our public. In fact, it jumped up more than ever. We have around 2,400 services online, and most of it was used during the lockdown, is continuing to use. And how we make it stick is that we've now proposed that 50% of our customer care centers will shut down within 2 years, so that actually this digital services moves into a stronger area. The other thing that we did very early on, and something that where we see why if we do today, we will reap the benefits of tomorrow, is that we invested heavily in smart education with the Mohammed bin Rashid program for education. So heavy investment was on public schools and getting them geared up to go digital, even though they weren't going digital, it was just on some classes. But this helped us with migrating into completely online schooling when we needed to be. And in fact, one of the things that we announced, His Highness, our Prime Minister, His Highness Sheikh Mohammed bin Rashid Al Maktoum, announced last week that we will be doing a digital school platform for the refugees. So this is something that we say that it's not just something that we want to benefit from. We benefited from it today, but we noticed that a lot of the children in our region and across the world stopped their education. They stopped learning. They weren't able to access. And we see that the new norm is that there might be a bigger digital divide between and accessibility to the digital. So for us, we are early interventionists that we don't want to see that, because that will cause other issues down the road. So giving people access to education is something core, and that's why we announced the digital school program, where we'll be accessing and we'll be piloting with 4 countries and providing an accredited form of schooling. So it's not just online schooling, it's actually accredited as well. So these are some of the things that we think will stick, but we also believe that agility in regulation, agility in policy making, this fast track approach, that there isn't going to be one size fits all. There probably will stick 2 tracks. One, when there's an urgency with a high priority, there will be an actual path to be able to achieve that, and one which is the normal path. And we feel that it wasn't just the fact that there's a crisis that we had to move to the agile and the extreme and the fast approach. We hope that this approach actually will be a proper structured framework and track going forward. And that's why we plan to announce our agile framework, so that we make this more mainstream and institutionalized as well.
Thank you, Huda. So a couple of comments. Number one, you all heard that they're closing down 50% of their physical customer center. So really like changing the infrastructure coming out of this. 2, I think it's always difficult to make the case to spend money before you need to, and every government, this prevention money is quite hard, but having these stories now that we can tell that are right at the top of people's minds, that storytelling to the public or to other people, I think is going to be quite important. And you did it so nicely there, Huda. I think lastly, this agility and regulation is quite important. It's always been important with all the changes in tech, and Huda and I are on the Agile Government Global Committee for the World Economic Future Council for the World Economic Forum. And we have there, and I will tweet it out, a toolkit for regulators on both agile procurement, but also on agile regulation. The changes that are coming ahead of us, the speed of change, we're going to have 50% less jobs in the next 20, 30 years around our country. So we better get agile, better get fast. I think this is a bit of a dress rehearsal. Siim, over in Estonia, what's going to stick, and how are you going to make it stick?
Well, quite a few things we hope to make stick. In a sense that, I mean, as I mentioned before, like, you know, we had to scramble ourselves in terms to get the data literacy and so data flows up and data governance in place, that, you know, we would have actually good data to build from all the responses. So obviously these things we're trying to catch up on and really take this as a learning lesson to say, look, we need this as a proper platform. Like I said, data literacy, data governance, I mean, so basically all these elements that, you know, should be there for data-driven government anyways, right? Secondly, just wanted to echo one point, Lisa, you made it. I mean, obviously it's the prevention investments always come a bit too late, right? So basically when already some crises happen. But I'm always an optimist that, you know, that we take some of the lessons on board, at least we'll be ready for saying similar kind of stuff a bit better. Because I mean, it feels that the sort of pandemics are not just like, you know, wars in a sense that the next war is kind of different from the last one. I mean, there are things we can learn from them. And obviously, as we see, for example, in Southeast Asia, so the countries with SARS obviously were a bit more prepared when COVID hit, right? Yeah. So I'm hopeful that in a way we can transmit and build on some of the lessons. But if I actually say beyond Estonia a bit, what as we're speaking in the OECD format here, I mean, I do have this hat of chairing the OECD Senior Digital Government Officials Working Party, and there we see quite a bit that several governments who previously, quite frankly, had a hard time getting their act together in terms to go digital and sort of be sort of quick and responsive enough. Basically, they had a crash course of doing it overnight now, and so I'm hopeful that that sort of experience shows them it can be done. So basically, that, you know, there's more of attitude, let's do it, as opposed to let's discuss first and more and more. So and this one I'm trying to get to is that perhaps we'll continue, but with this in just a tiny bit with you. But my warning point is that in a way, these things will not last unless we consciously work to make them last. And even if not for worse, I'm sorry, I'm going to sound so ignorant now, but the crisis has not been long enough yet to make them last just by themselves, or to take the changes for granted yet.
Yeah, you're not the first person to say that, Siim. Fear that the pain hasn't been deep enough in some places, and no one's rooting for that. So how do we as humans make that happen without having more pain? And that's leadership. You heard that Huda's government has commitment to just closing things down. Like when you make a commitment that could be helpful. Adhya, we're going to go to you. What's going to stay? What's not? And how are you going to make sure it stays? We've got some storytelling, got changes in budgets and physical. What are you going to do in Montenegro?
Well, when it comes to new normal trend and what's going to be stick, I think that we have two crucial words: distance and remembering. COVID will most probably alter the world as we know it. It has affected numerous industries, changed the way we interact, and has ultimately changed the workspace as well. We all know that life and work will never be the same, even if we don't yet know all the ways in which it will be different. Keeping the distance, less personal contact, and to an extent work from home is something we can expect to become a norm even with the virus is defeated. In the following years, we might see a number of governmental agencies decreasing or abolishing direct in-person contacts with citizens, completely switching to electronic communication and electronic service delivery. Shift towards a more remote workforce as a long-term trend is surely already now spread and will continue further. There's just so much we have learned about COVID, such as flexibility of people working home, the productivity that can be driven out of that, and it made us move away from traditional thinking that the productivity is contingent upon set hours within an office environment. With social distancing measures and alternative working patterns, it will also affect the need to commute to work and reducing traffic jams. COVID also brought into sharp focus the importance of the good workforce and mental health. Social distancing have affected many since humans are social beings. Although we are faced with the fact that physical separation reminds us how far apart we really are from each other. At the same time, we discover how dependent we are on each other. I believe that there are two questions we are all thinking about now. How can we make the most of the present situation? And when it's over, what will the normal look like? The COVID is one of those giant events that divides life into before and after. We live through them, learn from them, and adjust. There is no security that the current norms will stay in force long after the pandemic is over. The only way to know for sure is if some of those measures are institutionalized. Remembering is crucial work. We have to make sure to remember everything we went through and to learn from that process as much as possible. Collaboration, flexibility, inclusion, and accountability are things organizations have been thinking about for years with some progress, but the massive change associated with the COVID could and should accelerate changes that foster these values. There is never a single solution, but we can make informed decisions and share experience to help us plan and build resilience for future challenges. We are richer for a very important knowledge to pass on to generations to come, as we had hands on an experience with the most devastating global event in this century so far. Remembering will make us more than ready if the similar circumstances happen ever again. In the coming period, which we recognize as crucial, we need to use the current positive trend of e-service usage to improve these services and to work on the implementation of comprehensive online service delivery. The usage of e-services and ICT in general was in core of our existence in 2020. IT connection between each other has improved. Online business have increased in many fields, representing a powerful guide to the further development of public administration. Further actions in institutionalizing discovered and defined gaps should be accelerated at all levels. They are necessary since this pandemic forcibly stopped us to see where we are, what we have done, and what is before us that we need to do. Even if we want to continue where we were before, we can, because nothing is the same anymore. COVID is as a good parent, give us the tailwind, literally pushing us to develop further on our path. And our path is the path of modern public administration, the path of digital transformation.
Thank you very much. I sense a bit, I like your word remembering. I live in Germany and the Germans use this term remember a lot to make decisions about everything they do. I want to be a little bit of a, back to Siim's point, I want to be a little bit of a controversial here and say, we may all have an optimism bias going towards whether or not the new normal is going to happen. I'm a bit worried with that optimist bias that we won't institutionalize committees to make us remember. and to change things for the new normal. Last comments from Indonesia, and then we have a few questions. So if you can keep your responses short, we'll get to some of the questions and some of the comments at the chat and some last polling. Professor Wiku, what's going to stick in Indonesia? Well, clearly you have a new data center that looks at this. That's a huge legacy to leave, but what else?
Yes, so we developed a strategy for the new normal. Basically, we understand at the beginning that this health problem, public health problems, will create other problems, economic problems, social, cultural problems in Indonesia. Since we are very diverse in culture, we know that this will affect their daily life. Physical distancing is one of the example, because we are so close to each other in terms of the culture. And now we have to have the distancing, and it's hard. And we never wear mask, but now we have to wear mask, and that's a big change in Indonesia. So what we developed in terms of the strategy, since we are the a big country, so we have 5 steps. So first is the preconditioning, second is the priority, the third is timing. The fourth is the coordinations between central and local governments. And then the fifth is the monitoring and evaluations. So we let the local leaders, the mayor, governors, district head, to make sure that they are in command. But before they open, whether it's opening the industry, the school, the business, or the transportations or the tourisms, they have to precondition the society, and they have to prepare the hospitals and all of the health infrastructures ready if they want to open something. And then they have to put the priority, make sure that they list the priority, which one that least in terms of the disease transmission, but high in terms of the economic value. And then they have to have the ability to have the timing, which one and when. And by doing this, they have to make simulations before they open it, and then with the agreement with the society. And then if they need help, they have to coordinate with the central government. So all of the reagents and etc. are supplied by the central governments, and also the budgeting. And then we use the dashboard for the cases and the dashboard for the behavior. So we have the applications or system where hundreds, thousands of volunteers, army and police all over Indonesia report every second. So we have like 500 reports per second from all over the Indonesia, and we know whether they wear mask or have a physical distancing or not, etc. And then we can control directly. So basically, we let the people go back to the new normal life, which is different with the previous one, and have their own dashboard and manage the situations. And it seems that several areas in Indonesia have been recovering from the fear, and then they are accustomed to the situations, and then they start the businesses, the offices, although it's 50% operations. So, you know, that's the new normal that they are doing. And then in the same time, last point, that the government of Indonesia is also preparing to have the vaccine for the people. So we are shopping around in the world to get the sufficient vaccines, and also developing our own in Indonesia with the scientific communities. So make sure that we have a double shields. First is the behavioral change. The second is the vaccines. So that's the investment for the economic activity and social, cultural activities.
Well, I think we could, thank you for that. I think we could have a whole nother version of this post-vaccine distribution. I think there's going to be a lot. I just want to ask a few yes/no questions. So just answer yes or no to these, if that's okay. No explanation. So did you in your government have a psychologist sitting next to the scientists, the sort of the COVID scientist with you? Did you, Estonia, to think about?
No.
No. Huda? Was there a psychologist?
Mental health, yes.
Mental health, yes. Montenegro?
Not really.
Not really. And Indonesia?
Yes, we do.
You do. So it's going to be interesting to see the different responses. And another question, this comes from, now we're getting to the questions from our participants here. For Johanny Lemek. Hello, Johanny, nice to hear you. Yes, no, does your country have mandatory mask policy, Estonia, countrywide at the federal level?
Yeah, hi, Johanny. Voluntary but strongly recommended. So basically, yeah.
Yes. Huda?
Yes.
Yes. Montenegro?
Yes, and it's compulsory.
Yes, compulsory. Indonesia?
Yes, we do.
This is going to be one of the biggest tests and interesting responses of my country, a newly elected, although that's a whole another conversation, President of the United States. What's going to come down at the federal level? Really interesting. We have another question here. Will the role of government increase or decrease post COVID-19, and how do we accelerate agility? Let me just ask the increase or decrease. If you could answer increase or decrease. I know, Huda, you hate this when I make you answer these sort of questions, but it makes it more interesting. Increase or decrease the role of government? Estonia.
So,
Increase.
Go ahead. Increase, says Estonia. UAE?
decrease in size, increase in importance.
Nuance, good. Montenegro?
Increase, definitely.
Increase. In Indonesia?
Increase.
Okay, let's go ahead and put the final polls up so people have the time to do them. I'm going to test this optimist bias to see how optimistic people are that there's a new normal. We heard from Admir the need for remembering. We also heard from Siim, perhaps this hasn't been a deep enough pain yet to make real radical changes happen. Although we're hearing a lot on the digital front, things are changing. Lots of talk on the chat too, Huda, responding to your questions around how to measure productivity. So outcome-based results. But it'd be interesting to put out to the OECD community if any government has like a formal framework and sort of dashboard around that, because that is something that people are asking for, how to have that. Another question from Arman: how do we plan for and address future threats that may impact our growing reliance on digitization? Estonia, do you have I know the answer to this, but do you have a foresight unit that helps you with this?
Well, actually not that systematically, I have to say, but this is something we've been trying to sort of build within as part of our constant sort of iterative strategy within our own team. But basically, you know, this is just, you know, the beginnings of that, not more.
Beginnings, UAE.
Maybe Lisa, if I can say, I mean, we have this thing saying that don't let a crisis go to waste. So I think for us, as early as March, we were tasked to develop a post-COVID strategy. And so there was a team that was looking at the trace tracking, the data, the how to subside, the gearing up of the stimulus, but there was another team in parallel really working on post-COVID. And the post-COVID strategy looked at opportunities. So addressing the challenges today, but really looking at opportunities and in all the different sectors, short-term and long-term, and what does the government need to do today to be able to reap those opportunities? And an example of that is that we didn't stop our space mission. We launched our probe to Mars in the summer. Hopefully in February, it will be landing in Mars. And we didn't just pause. I mean, other governments would be pausing investments in new areas. We actually doubled it. We then announced our mission to the moon, that hopefully by 2024. So all of this while we're fighting a pandemic. So I think the key message is that because we reap the benefits of early investments early on, we're doing exactly the same approach this time around, is investing on what's going to be the thing that will leapfrog us 10 years from now, but invested while we're in a pandemic as well.
Yeah, don't let a crisis go to waste. UAE has a post-COVID committee. Montenegro, do you have a post-COVID committee or a strategic foresight unit that will help sort of look ahead at the crisis to come?
We have something like a national coordination body that is making some plans for the future, but since we are in the phase of changing the government, now they're a little behind with these activities, but I don't doubt that it will be done in the future period.
It's a really interesting challenge and opportunity between the career civil servants and when the politics changes. And one just observation I've had is just how important to have political leaders that know how to handle crisis and the power of communications to do that. How about in Indonesia? Do you have a strategic foresight unit or a post-COVID committee working on the post-COVID world yet?
Yes, we do have it. The president had a decree on the committee to handle this COVID. So he made two task forces. One is the task force to control the COVID-19, which is what I'm in. And also there is a task force for the National Economic Recovery Plan. So that's two task forces within one committee. And then we have the spokesperson for that. And then we have the plan on recovery of the economics and with the new normals. And then specifically for health, we improve our health systems because we are part of the global health security agenda. And then we invest on the capacity to detect, prevent, and respond to the emerging infectious diseases. We know that this disease is coming from animal, which is zoonotic, although the transmission is human to human. So we are preparing the whole capacity to detect through the laboratories. We started with the one laboratory for supporting the COVID-19, but now we have 442 laboratories across Indonesia, which is not only the laboratories under the Ministry of Health. It's also the laboratory under the state-owned enterprises, under the military, the police, and also the research and technology, and also the Ministry of Agriculture. So all of the networks of the laboratories is becoming the detection tools for Indonesia in the times of crisis or war like this, war with the virus, then it's the capacity to detect. But in the peaceful era, it's support for the drug vaccines development for Indonesia. So that's
great.
We will be harvesting because of this COVID. Through the up to now, we are very dependent upon imported drugs and pharmaceutical products. So by having the COVID-19, we changed this in terms of the industry, in the pharma industry, and also on the health systems. So this is
That's great.
Of the health systems.
Lots of internal capacity building. We see that around the world, things that we thought we could count on before, but the building that capacity. Let me just get back to the audience and their polls. So are they as optimistic? So how optimistic are you in the new normal way of thinking sticking? 44% said very, 44% said somewhat, and only 11% said not at all. So they tend to be optimistic with us. And then I asked, what is the most important thing we can do to make sure positive, effective new normal approaches stick? So you have a post-COVID committee, Huda. Number one, upskill the workforce, which is something we're obsessed at Apolitical. These soft skills that aren't so soft, really critically important in mindset. 0 people said political pressure, which is interesting. More praise for what worked. So not just talking about what didn't work, but saying, hey, this did work, that's 25%. And then reorganizing government, thinking about it in different ways. So with that, I'm gonna ask each of our panelists to give me your final one-word feeling about the next 6 months. If you could encapsulate in a feeling what the next 6 months is gonna feel like, what would it be in this last 30 seconds? Estonia, your feeling. Oh, you're muted.
Make or break.
Make or break. Huda.
My feeling is that it's sticking. It's staying.
Sticking.
We just need to, yeah.
Sticking. Montenegro. Oh, you're muted. The word of the 2020 year.
Sticking and distancing.
Sticking and distancing. Professor Wiku.
Optimist.
Optimistic. My last word is grateful for each of you, and not just each of you, but every single public servant you represent that isn't here. Many of you are working around the clock. We all know that executive function goes down when we don't take care of ourselves, sleep, rest, exercise, be healthy. We're not done. We're in the middle, if at best. So I all hope that you all are taking care of yourselves to be good leaders as we learn from this, make sense of it, stay healthy and wear our masks, but take care of yourself and your teams in this new normal, or else it won't stick. So with that, I'd like to sign off. Thanks to everyone. I'm waving here. Thanks to everyone who joined us on this stream. And there's lots more aftershock. I will pop my Twitter address in if the other folks want to be followed. Just let's keep in touch and keep supporting one another. Bye, everybody. Thank you. Stay optimistic. Ciao. Make it stick.